The job cuts sweeping across U.S. health agencies have triggered widespread alarm, with devastating consequences for both the workforce and the country's health infrastructure. As notices began going out on Tuesday, employees were shocked to learn their positions had been eliminated, some arriving at work only to find their building access was revoked. This massive restructuring, including the elimination of thousands of positions, is being touted as a necessary realignment. But the sheer scale of the job losses and the manner in which they are being executed are raising serious concerns about the future of public health in the United States. At the heart of this upheaval is the decision to cut approximately 10,000 full-time employees at the Department of Health and Human Services, HHS, in addition to the thousands who have already left the agency. HHS Secretary Robert F. Kennedy Jr. framed the cuts as an effort to focus on prevention and reduce bureaucratic inefficiency. But this narrative feels increasingly out of touch with the reality of what these cuts will mean on the ground. The affected agencies, including the Centers for Disease Control and Prevention, CDC, the Food and Drug Administration, FDA, and the National Institutes of Health, NIH, are now facing significant gaps in expertise and personnel that will undoubtedly undermine their ability to effectively protect public health. The immediate impact of these cuts is already being felt. At the CDC, entire divisions that deal with crucial public health issues such as workplace safety, HIV prevention, reproductive health, and smoking cessation have been decimated. This, at a time when the world is still grappling with the long-term effects of a global pandemic. Health experts and former agency officials are voicing strong concerns about the dangers of such drastic reductions. Dr. Robert Califf, former FDA commissioner, warned that the FDA's ability to review the safety of products will be severely compromised, with potential delays in the approval process and a weakened oversight mechanism that could lead to unsafe products entering the market. It's difficult to overstate the gravity of this situation. The loss of institutional knowledge at agencies like the FDA, where leadership and experienced staff members have been let go, will make it harder to ensure the safety and efficacy of drugs, medical devices, and food products. The implications for public safety are chilling, as the reduction in staff will likely lead to delays in reviewing new products, increasing the risk of unsafe items reaching consumers. At the FDA, in particular, the elimination of entire teams, including those in policy, regulatory programs, and media relations, signals a dangerous erosion of transparency and accountability in public health governance. With the press office being gutted, the public will have less access to crucial information about food and drug safety, leaving many vulnerable to misinformation or a lack of information altogether. Furthermore, the office that handles Freedom of Information Act requests, which ensures public access to government records, has also been severely impacted, hampering the ability of journalists and citizens to hold these agencies accountable. The cuts also signal a broader philosophical shift within the administration, one that prioritizes cost-cutting and efficiency over the welfare of the American people. While the stated goal is to reduce bureaucratic sprawl and refocus efforts on chronic disease prevention, the abrupt and widespread nature of these cuts suggests a lack of careful planning or consideration of the long-term consequences. The dissolution of entire offices, such as the Office of Minority Health, is especially troubling, as it exacerbates existing health disparities in underserved communities, particularly among racial and ethnic minorities and rural populations. This is not just an economic issue. It is a matter of equity and access to critical health services. There is also an unsettling sense of disarray in how these cuts are being implemented. In many cases, employees were given little to no notice and found themselves locked out of their workplaces without explanation. For those who did receive formal notifications, there were reports of errors in the paperwork, such as inaccurate performance ratings that unfairly lowered severance pay. Such mismanagement adds insult to injury for employees who are already dealing with the shock and uncertainty of losing their livelihoods. It is hard to escape the conclusion that this entire process has been rushed, poorly executed, and lacking in basic respect for the affected workers. These cuts are part of a larger trend of hollowing out federal agencies under the guise of efficiency and reform. However, The risks of undermining critical health infrastructure at a time when the world is still recovering from the devastating effects of COVID-19 cannot be overstated. The U.S. is already grappling with the fallout of past decisions to scale back public health efforts, and these latest cuts will only exacerbate the problem, leaving the country ill-prepared for future health crises. Furthermore, the impact on the public is likely to be felt for years to come. Programs that assist low-income families with heating and cooling bills, provide child welfare services, and offer critical support for refugees and homeless teens are now under threat. The National Energy Assistance Directors Association has warned that the Low-Income Home Energy Assistance Program, LIHEAP, may be crippled by the cuts, leaving vulnerable Americans without the help they need to manage basic living costs. These actions reflect a broader trend of dismantling the safety net that so many Americans rely on. The promised savings from these cuts will likely be minimal in the long run, while the damage to the country's health infrastructure and the well-being of its citizens could be catastrophic. There is little evidence to suggest that the savings from these layoffs will be reinvested in more effective health initiatives or that the reorganization will lead to better outcomes for the American public. In the end, these cuts reflect a troubling disregard for the long-term health and safety of the American people. The impacts will be felt not only by the thousands of federal employees who have lost their jobs, but by every American who depends on a functioning public health system. The disruption to critical programs and the erosion of expertise at agencies tasked with protecting public health are a dangerous gamble, and it's hard to see how this will lead to anything other than a weaker, less prepared health system. As these cuts continue to unfold, there are serious questions about whether the administration is truly prioritizing the health and well-being of its citizens or simply advancing a reckless agenda of downsizing at any cost.